Hi, CT Dental Assisting students. Welcome back. This is T85,000. Happy New Year, by the way. So today we'll just be briefly flying through Unit 17. That has to do with community dentistry. So basically, ladies and gentlemen, community dentistry is a discipline concerned with the science and the art of preventing oral diseases. This is done through promoting oral health and improving oral health, as well as the quality of life at a population level. Our activities basically involve assessing oral health problems of various communities, planning as well as implementing appropriate interventions to address emerging problems. So that's essentially what community dentistry entails. So the aim of community dentistry is to improve oral health experiences of the local population, and all dental practitioners are expected to be involved and engage with not only the community but stakeholders as well, because we essentially rely on especially in the public sector, engaging with stakeholders and calling upon them to provide us with the necessary facilities to actually get out and be involved in our community, provide aids, provide visual resources that they can actually use and implement not only by themselves but to their family at large. So that's essentially what we try to achieve with community dentistry. Ladies and gentlemen, as you can see, there's not much learning outcomes and practical skills that they expect you guys to know of. There usually is an assignment that pertains to community dentistry, but we will inform you guys in due course if such an assignment will be expected of you guys, or if it will just be adjusted to actually be conducive within this COVID-19 setting. But all in all, I think more than anything, just know what community dentistry is, what it entails, and then from there, everything else will just be discussed on the following slides. So under Unit 16, apologies, under T85,000, you can see this zero cavities dental project, which was presented by Dr. Oosthuizen. So essentially, they had worked with a stakeholder, in this example being Colgate, basically just to screen patients in strip malls and other facilities, as well as to provide oral health education, as well as the promotion of oral health within our community, which is basically the region of Mangaung. So institutional objectives that they wanted to establish basically is, like I mentioned before, establishing necessary structures, the collaboration of partners in integrating community service, our partner in this example being Colgate, as you guys can see from the above slide. And then from there, it is to develop community partnerships, because sometimes you do not necessarily have to rely on stakeholders. You can even find like community leaders, for example, like ward councillors, that can actually maybe intervene or basically get you guys resources, or even get community members involved at places such as recreation centers and local halls to actually hear what you guys have to say. Ne? So like I mentioned before, we want to integrate teaching and learning. We want to stimulate community-related issues. So basically, by engaging with the community, ladies and gentlemen, you will get a sense of the type of oral diseases that plague that community. So in addition to oral hygiene, you basically give people the necessary information relating to the particular issues that plague that community. I'll make an example in a province such as Western Cape, where there are a lot of tooth extractions, a lot of missing teeth, a lot of prematurely extracted teeth. If you're in such a community, obviously you'd want to stress oral hygiene, promotion and education, but we'll also be highlighting the need for them to get dentures, to actually look into their diets as to what they're eating that is causing the early loss of teeth. So those are some of the things that we're talking about in terms of community related issues. One community maybe like a high geriatric area, or has a high geriatric population. There you'll be talking to more of your elderly patients. Like I said, in terms of dentures, you'll have to talk about their chronic medications, and things like that, just to facilitate learning essentially in that community. So we also want to enhance extracurricular community service, and then from there ensure that we have centralized marketing and recording of community engagement, because there's no use in going to the community, hence the importance of screening, because we want to find out what plagues the community. We want to give them the necessary education and aids to facilitate good oral hygiene, and then from there continuously monitor if what we have implemented, or the aids or the education that we have implemented, has actually worked or benefited the community. So those are some of the objectives that we would be trying to assess. So this is just an example of Colgate in our community during their outreach program. So in terms of dental assistants, we expect you guys to be in the forefront in terms of oral health promotion. We expect you guys to be in the forefront in terms of addressing the treatment needs of the community. So that basically being said, talking to people, giving them aids, giving them examples of things, because sometimes it's very quick for us to be like, oh, buy floss. Some people cannot afford floss. That's when then you must come up with creative ideas that people in the community can use to actually achieve good oral hygiene. So instead of maybe floss, others could be like, okay, take that orange sack that we get with our oranges, and then from there remove the strips and actually floss with that, or even thread that you find, common household thread that you find in the house, as opposed to floss if finances are an issue. So those are some of the things that we expect you guys to talk about and provide creative ideas for people, if especially when finances are an issue, which they normally are. So this slide just shows you guys some of service providers that you can call upon, especially if you want to try and do like a community drive in a particular area. So that would be the likes of your Colgate, dental practitioners, the Department of Health, oral hygienists, not only from the school, but even others in the private sector that are passionate about community dentistry. We have 3 military hospitals that provide dental services, as well as even the dental assisting students from the Central University of Technology. So those are some examples of some service providers, but it's not always Colgate. I know Colgate is in the forefront of community dentistry, but you can even try the likes of Sensodyne, because they normally bring like brochures and pamphlets, and even some sample toothpaste that you guys can give to the community at large. So those are some of the things. So just don't be scared to just ask around, because normally if you ask around, they might just ask for statistics, and then in return they give you some equipment that you can use to facilitate this community project that you're trying to bring upon. So the next slide then talks about community sites throughout South Africa. So yeah, like Johannesburg, Pretoria, Bloem, Western, Eastern Cape, as well as KZN. So those are predominant sites that Colgate, for example, tries to infiltrate with their community services. So this is just an example of a booth that you will be receiving should your request be approved. And then this is just an example of leaflets that we will be handing out to the community. So you might actually try, because some people are just quick to just take the leaflet and go about their lives. Use the leaflet to actually entice a person to actually come to your booth, try and explain the leaflet briefly whilst you still have their attention, so that when they actually leave your booth, you might have someone who had heard something they didn't know of previously that they might actually want to try and practice once they actually get home, not only with themselves but with their loved ones. So typical stock provided by Colgate would include masks, gloves, tongue depressors for those quick intra and extra oral examinations. We have some disinfection wipes, dental coats, surface disinfectants, as well as hand sanitizers, which is important now in these times of COVID-19. So from there, once you have received your equipment, you have to determine the population that you want to target. So be it at your local clinic, you might have a mobile dental clinic where you might actually even go to certain areas that you want to target, or as well making use of other stakeholders, like we said, such as your ward counselors, that you may actually try and get like a community hall, ask them to maybe call upon the people in the community to just hear you guys and the message that you would like to relay eventually. Okay, so from there, they just telling you about mall shoppers. So once you've identified your target population, just know how they think, how they feel. For example, with a mall shopper, they're shopping for a purpose. They have a mid to high income. They can't afford to go to dentists and doctors. They usually come from families, and they tend to waste money on non-essentials. So once you target those people, you can actually entice them. And if they like what you're saying, they can actually come to your practices or to your local clinic and actually get oral health services, which is also what we are trying to achieve. So here's just a picture of a booth at one of the local strip malls. You see, taking care of our pediatric patients, our adult patients as well, having sure that you have a child-friendly booth where you have their attention and actually promote oral health, and then as well even having a mascot, that can just keep everyone entertained and attracted to your booth. So like I mentioned before, dental screening is very important. You screen, you give time for the necessary intervention, and then from there you return to said community and actually see if your intervention worked, what failed, what you need to even improve upon. So like I mentioned before, mobile dental units can be used. Everyone in the oral health sector needs to be involved. That includes dental practitioners, dental therapists, as well as oral hygienists. And then from there, screenings are conducted according to the SNI, making use of a specific criteria, and then from there we can chart our findings and then evaluate our findings to try and see what we can improve upon, just to improve the general oral health at the population level. So, ladies and gentlemen, once you're dealing with oral health education, like I mentioned before, the purpose would be to increase oral health knowledge of the community, being our patients, by giving them their relevant instructions. So that's when essentially you have to deal with the target population by identifying the population that you're dealing with. Obviously, if it's a mid to higher income bracket, you can easily talk about your floss and your mouthwashes and your fluoridated toothpaste, and then going to dental practices and so on and so forth. But if you're dealing with your lower income brackets, obviously promoting them going to clinics or hospitals, dental practices if they can afford, using soft toothbrushes, fluoridated toothpaste, making use of fluoridated water. Hence the need also for advocacy within community dentistry, so that they can actually promote the use or implementation of fluoridated water in South Africa. I know it is, but sometimes because there are a lot of people who are not necessarily for fluoridated water, we need to maintain our advocacy for fluoridated water, so that we can actually reduce dental caries at that level. So how do we go about giving oral health education? There's lots of aids. Here's an example of screening. So we first want to screen our patients, talk to them, and then from there, sometimes you can even ask the patient to actually explain to you what they do or what they understand about oral hygiene, and that's when then you'll provide the necessary corrections once they're actually in your chair at your oral health booth. As a result, it should not be shocking. Normally, you'll find yourself having done about 4,000 screenings over the course of your intervention, and then from there, lots of oral health education as well as promotion. As you can see, this was around, it looks like Kenworth Spa, so a lot of people came through, a lot of lessons were learned, and you know that's great. So from there, in terms of dental treatment, you can provide suggestions such as oral hygiene, scales and polishing, fissure sealants, especially for our pediatric patients, and then fillings and extractions for everyone else. Many young adults find themselves needing surgical removal of wisdom teeth, and then from there, our elderly patients then having problems with dentures. So those are some of the things that they did identify, and those are some of the things you'd expect to identify in your particular, or how can I say this, in your particular population, and then actually trying to provide solutions for said problems. The challenges of these activities, ladies and gentlemen, is that more often people feel threatened when they're approached. Sometimes you can find that people are quite rude. Don't be dismayed, because you know what you are working towards. And then obviously there's that natural fear and anxiety for the dentist, as well as dental phobia. People are scared of our machinery, all the sounds. The dental IQ of patients tends to be quite low. So it is then your duty to actually improve this IQ. And then there's also continuous long queues that might deter other people from getting an education, and so on and so forth. Some comments. So what comes next? Like I said, you'll do your screening, you'll provide education, provide some aids, and then from there, wait an X amount of time and go back to said target population and see if your intervention actually worked. Okay. The project, like Dr. Oosthuizen had mentioned, was a success every time, at every place that was visited. Provide, ladies and gentlemen, a quality service all the time. Don't forget to have fun. You might have rude people, you might have silly moments, but don't be deterred. Just have a joy out of it. And then from there, lots and lots and lots of teamwork. So under normal circumstances, we expect you guys to be good problem solvers, think critically, and have creative thinking. Like I said, instead of floss, people can be using common household thread. So we're talking about creativity on that level, providing solutions that are practical in a normal South African household, low, middle, as well as high income households. It is to conduct a project on your own, work as part of a team, have the necessary ethics as well as good communication skills. So that's what we try, or that we hope you guys will be having by the time you guys get your necessary qualifications. So that being said, that's basically it when it relates to community dentistry. I can't really go into much beyond that. If anything comes up in terms of assignments, we'll try and figure it out and relay said messages to you guys. I think I felt the need to touch on this more than anything, because we don't know in the future where you guys are going to work. So it's just best to just highlight as much as we can, so that you come out as the best possible product from our institution. So more than that, if you have any questions, feel free to answer me. There isn't anything relating to community dentistry in your textbooks, because obviously it's an American textbook, but it is very popular in South Africa, especially if you'll be working in the public sector or in a private setting, especially if you're dealing with a dentist that is very passionate about community dentistry, okay? But more than that, we'll relay. Just go through the frequently asked questions. If you just know what I've basically relayed to you, you should be fine. Just know what community dentistry is, be a people's person, maintain a certain level or a high level of professionalism, then you should be fine. If you have any questions for me, I'll see you guys soon. Please feel free to email me or just message me under our CUT YouTube page. Okay, see you guys next time. Bye.